Hi everyone, welcome to Fast Intelligent Care. This is our part two with Natasha Nutt from Movementum. In our previous episode, we talked a little bit about her background getting into OT as well as starting Movementum, and talked a little bit about the role of an OT in manual handling and also some of the barriers with change within the manual handling care plan. So today's episode is going to focus on single-handed care and also what the future of manual handling might look like and how it's changed over time. So thank you again, Natasha, for joining us for these podcast episodes.
Thank you,
Uh,
Chanelle. It's great to be here.
Thank you. So my first question, because I know there's probably a few therapists that haven't heard of single-handed care before, is how you would describe single-handed care to a family, to an individual, or to a therapist.
Yeah, and I can understand the confusion because I feel like single-handed care, it's like, well, you're doing it with one hand. It can be a bit confusing. But really, single-handed care is just around care that is assessed to have the right number of people with the
Mm.
equipment that needs to be there and a technique that supports it to happen safely and sustainably. So really, I feel like it is what we've always done in terms, especially at Movementum and in the work we're involved in, this feels like what we've always done. But it is quite different in the sense that if someone is used to hearing things such as you need two workers to use a hoist, this
Mm.
really challenges that to say, well, it should be that the service is assessed for that individual in their environment. What do they genuinely need? Because
Mm.
not everyone, depending on their setup, not everyone needs two people to be able to be safely hoisted for their
Yeah.
routine. So single-handed care, I actually love, there's a few terms that get used, right-sized care or optimized care, which is really looking at doing an assessment and determining just what is a suitable ratio of care partnered with the right equipment and the techniques to support that person effectively.
Yeah, I love that. That's a great way to put it. And I think I've also come across there was like a little survey that was done on potentially changing the naming of single-handed care because of the name itself was a bit of a barrier. Like you said, it's
Absolutely.
people thinking like, oh, like you're now taking away work of support workers or you're making it unsafe. But I like the optimized care one. It's a quite good one. But I feel like single-handed care has been used a bit more, I guess, for a longer time, so it's a bit more recognized. But I
Yes.
do like the explanation of it. How we're not just it's almost like we're not just doing a blanket statement or blanket
Mm-hmm.
rule for everyone. Everyone has that. We have that individualized approach,
Yeah,
especially your risk assessment.
absolutely.
With single-handed care, do you feel like that's something that I know it's a lot in the UK. That's a big focus in the UK. Why do you think there is a move towards single-handed care a bit more in recent years? And do you see that happening in Australia?
Yeah, I do feel like the UK is absolutely leading the way here.
Mm.
And I think Australia has a lot of room to grow in this area. And I feel like we are going to need to grow. There is absolutely workforce pressure. So I work with a lot of care organisations and I know they are always recruiting. They have this constant need that more people need care. There's not a large enough workforce to be able to sustain that care. So there is pressures there on a workforce and particularly with an aging population.
Yeah.
So we are in a position where people want to stay at home longer. Government is also supporting people to stay at home longer, but we have an aging population. We therefore have a diminishing workforce. So we really are in a position where we're not going to be able to have this blanket policy that anyone who needs that physical care in their home needs two people. It's just not going to be sustainable moving forward.
Yeah.
And also, there's a lot to really review to go, well, not only is it not sustainable, but it's not necessarily the best quality care just to always say that we need two people. So I think workforce pressure, there's also cost pressures, as we see with NDIS and support at home. So it doubles the cost of care if we're going to put two people in, and a lot of funding plans don't have that amount of funds in there to support that. So it does mean that people essentially can receive less care at home if they always need to have multiple staff members to deliver that care. So it can take away a bit of that that choice and those options there for what people can do in a day if they're going to have less care services available to them for their funds.
Yeah.
And I think also there's just a growing evidence base that shows that it's not necessary, that with proper assessment, and we have so many innovations and equipment, that really we don't need to be in a position anymore where we just add more staff to make things safe. We have
Yeah.
other options.
I've actually seen that there was actually a review or study done in the UK where they actually did implement this like single-handed care in a few facilities, and they actually found that with the focus on actually training the caregivers to use the equipment, right, instead of just saying, okay, put two people in and the person will be safe, with making it single-handed care, potentially just having one person and the equipment, they actually ended up having, like you said, sometimes it's better. They actually had a lot
Yeah,
of less near misses, less injuries, because now you don't have two people that aren't sure what they're doing, and potentially two people putting themselves at risk. You have one person that's confident, they know how to use the equipment, they have now the funding for the right equipment because they're not just
absolutely.
focusing on funding for two caregivers. So in a way, I think um, it's a way for support workers to also, or carers to also know that it's not that your single-handed care is not taking away their work. There's always going to be, like you said,
There is so much work for
there's
support workers.
they just want to be safer
Yeah.
with having the focus on being properly trained, being confident to use the equipment, and
And also having the care routines designed in a way that supports that care. I think that's fundamental to
yes,
this approach as well.
yeah,
Because there are a lot of care services where support workers would rightly so be thinking, if you expect me to go in and deliver this care now with one person instead of two, like I just can't do it. And I would agree. But this whole approach is really looking at that the care routine is designed in this way. So it is set up to be able to support
yeah,
less carers in there because they have the right equipment. So there's a lot of services that aren't set up like that at the moment. So it is really challenging for families or support workers when they hear this approach to think, well, there's no way I could do that, but they're working in routines that aren't designed in this way.
And what advice would you give to OTs that are potentially looking at having some of their clients changing over to single-handed care? How would you approach that assessment, that risk assessment, to look at it and potentially also reviewing it? What are some of the things that they need to be mindful of if this is something that they're planning on potentially?
Yeah, absolutely. So, like always with our assessments as an OT, it really starts with the person and their goals and their daily routine, and finding out, getting a clear picture of what their care ecosystem looks like. So, what does it look like in their home? Who's providing the care? What's the environment that exists in, and what equipment are they using? So, that's really where your assessment is starting, is it's still looking at all of that and what's important to the individual. And then when it comes to observing a routine, and that's probably fundamental, I would say you really need to actually observe someone's routine. So, yes, that may mean you being out there early in the morning, but you're going to learn so much more around what is happening and what can potentially be supported if you see the routine.
Yeah,
So, then for a single handed care assessment, it's really around observing it and then seeing, okay, where are the moments in this routine where the second worker, like what's the second worker doing? Where are the moments where they're needing to provide support, and being really clear in documenting each of those things, and then starting to look at, could that be changed in any way? Could there be, can I increase the capacity of the client themselves to be able to support in that? Like if they had the ability to be rolled more completely onto their side and supported with a wedge pillow, for example, does that mean they're stable inside lying? So you don't need a person to be standing on the other side of the bed to be supporting them in that way, as one example. So you're starting to look at, where are the times when the second worker is there? Is the second worker standing behind the commode and pulling someone back? Whereas if we had a tilting commode, could the person be in front and helping to guide them in? So it's starting to look at, what is the second person actually doing? how can I maximize the capacity for the client in those things, and how can I look to use equipment more effectively that actually allows that to be done by the one worker, rather than using equipment that really is poorly supporting that individual anyway and filling the gap with the second person.
I love that you added like the building the clients or the individual's capacity, because I think a lot of times we think of like what equipment can I put in, but I like that you added that in as well, where the equipment's not just for the support workers' benefit, but the
Mm,
equipment could also be to increase the capacity of the client. So I really like
absolutely.
that
Yeah.
as well, because that probably would be really for the client itself or for an individual that's actually being turned or being moved. That would probably give them a lot more dignity to be able to participate somewhat or to be able to do more when during
Yeah.
the handling routine. So I actually
Because
love that
sometimes when we
perspective.
introduce the second workup, what we can do without planning it to be that way, but we can take away someone's capacity as well. Because now there's two people, it's just a case of, well, you and I, as a support worker, we just get in and get it done. Whereas what I love about this single handed care approach is it really is creating more of a partnership between someone receiving care and someone providing it, to look at how do we work more effectively together. So I
Yeah.
do feel like there's a lot of capacity there to maximize how an individual is more engaged in their care, rather than them having two people completing their care for
Yes.
them. Yeah.
Yeah. Like things being done to them instead of with them.
Yes, absolutely.
That's really good. And when we're looking at single-handed care, I always say there's probably a lot of review involved as well, especially with clients that do have progressive conditions, a lot of changing needs. So I like that it's the approach of it is it's not a once-off risk assessment and then you've implemented the care plan. There's that regular review that if things do change over time, yes, we might then bring in a second person, but
Exactly.
in this moment in time, the person does have, or the support environment does have the capacity to support single-handed care.
That's exactly right. I feel like there's a few pillars there with single handed care, and it's the assessment process, and then partnering it and designing the care routine with really effective equipment. But then there's the training part for support workers and individuals and their families, and that people need to be really well trained. And so, if part of that care ecosystem is working with a care provider where there's a high turnover of staff all the time, well, maybe that's a situation where moving to single handed care isn't going to work for that individual, because there can't be really effective training with a team. And also, the next pillar really that I feel undermines it, that is so essential for it, is the review process,
Yeah.
and training that care team and the individual to know when are the trigger points where they really need to be requesting a review and requesting that the OT or the care coordinator come in to review, because that has to be ongoing, because as you said, people's needs change. So we can put in a routine that works really effectively with a single support worker, but that may not be the case in 6 months or 12 months' time. So the training is essential, as well as the ongoing reviews. Also, it is making sure that the care team know when to trigger a review.
Yeah.
So, what are the key things they need to be looking for that would have them request a review? So, an example of this is for a standing lifter, for example, I always make sure, if I've implemented and prescribed a standing lifter, that that care team have a really clear picture of what does it look like to use this well, and what are the things I need to look for where this isn't necessarily being used safely anymore. So if they can see that someone's bottom is starting to hang down, or the sling's sliding up, or their arms are riding up, that they're the markers, they're the things they need to be looking for to trigger a review. And it doesn't necessarily mean that that standing lifter is then not going to be suitable and that person's straight to a full hoist, but it is a point where at that stage we need to review, because that's no longer safe in the way it's being used. So helping care teams to know when to trigger a review is really important for single-handed care.
I love what you were saying about the giving the support workers those markers of knowing when to trigger review, because they're the ones that are actually spending so much time. They're seeing that client or that individual on a daily basis, whereas the OT might not see that client as often. So I
Yeah,
think it's
absolutely.
a good point actually that you've made to you're building the capacity of the support workers or the carers to recognize when there's almost that gap between I think it's Aideen Gallagher. She's always talked about like the gap between what the person's doing and what the equipment's doing, and then a lot of times the gaps, the support worker or the carer is trying to fill the gap when the
Yes,
capacity is
absolutely.
required, and then knowing when that is, when that gap is there.
And
So
I
I
think
love,
that's what single handed care really is aiming to do. Instead of filling the gap with what historically has been done by just adding more support workers, but never actually addressing what the risk was and what the issue
yeah,
was, single handed care is all about then, well, how do we bring in the right equipment that actually maximizes what someone's able to do and shifts the physical load off the carer onto the equipment, which is what it's been designed to do. So
yeah,
equipment is such an enabler when it comes to single-handed care. It's really partnering with what is an individual client able to do, what do we need the equipment to be able to do to partner with them, and then the support worker becomes the driver of helping to bring that together rather than the person who's coming in that needs this strength, this superhuman strength
yeah,
to be able to physically do it all. That
yeah.
shouldn't be the case at all. Single-handed care is partnering really effectively with the equipment.
Mm. Yeah, and like you said, like it's not necessarily a case that it's going to be a huge change. Like they're not going to necessarily not be able to now use their standard anymore. It might just be, oh, I need a different sling now that's a bit more
Yes,
supportive, or the client maybe needs a bit more verbal prompting. So it can be something really small, but it's not something that you're going to know unless you actually properly assess it. It's
that's
not going
right.
to be a huge change.
That's right. And I think now there's so many innovations with equipment that really have allowed us to move in this direction. So when I get asked around, well, what equipment would help make this possible, ceiling hoists really are a game changer in terms of supporting optimized care or single handed care. Because then we're not moving a piece of equipment around on the floor. We're able to get in a better position to be able to lower someone into their commode or their wheelchair. So ceiling hoists are amazing in this space. Now with the design of leave in situ slings, that really can mean that if someone's assessed to be able to use it well, that their sling is under them. So the next time a support worker arrives, maybe it's for someone who needs lunch and a change in the middle of the day. Well, the sling's already there. So
Mm.
there's not that physical task of trying to fit the sling. So these are some of the key things that can be built in. Leave in place slide sheets and bed mobility systems, which really are improving things. Even just the development in beds and the functions that beds are able to have. And we see just the profiling features, but also the ability for beds to be able to turn or roll an individual. There's really so many innovations in equipment that help to make this possible.
And I've even seen where there's even cases, like especially facilities where there's staff that are supporting a lot of different clients, where they might have a 2-to-1 support for one specific task, or maybe it's that initial sling application, but then they have the in situ sling that now for the rest of the care routine, they can actually just use that one person.
That's
So
right.
there's
Yeah.
that flexibility of it as well. And I like that.
Yes.
Like it's like kind of like a very creative solution, a creative way to look at it instead of just like, oh, but I need two people for this specific task. I don't always need two people for everything. Thank you, Natasha, for this great chat on single-handed care. I always love talking about it because I love that it's something I think that a lot of OTs are wanting to hear about. There's a lot of interest about it, but I think there's a lot more understanding, training to be done. There is a move towards it, even though we're not fully there yet. There's a lot of understanding still needed in terms of what it is, how it's implemented. But I'm glad that we're moving in that direction.
Yes. Absolutely. And that's where I do feel for single-handed care that will become the baseline, and that will be what is expected, that it is an assessment and that care is designed rather than this real blanket policy that if someone needs hoisting, they're going to need two people, because we don't have the ability to sustain that. And also, it's shown it's not actually the greatest quality care. So I feel like, yes, it is changing and it is evolving and we're learning more. But I think in the years to come, we will see this real design of care in this way will become the standard, which is exciting.
Yes, that is very exciting. I love the also like seeing the equipment that's supporting that as well, the innovation, the new, latest technology. I think with the stuff that we're especially seeing over time, where it's just probably going to be more and more available to people to be able to do that.
Absolutely. And you even think with ceiling hoists, they used to be so rare to see, whereas now they are readily prescribed, they are funded and recognised as a way that supports that care to be designed around, well, what is the actual number of people needed rather than just putting in two people.
Yeah. Thank you for your time today, Natasha, and we'll see you in the next episode.